Hey, well, good afternoon, everybody, and welcome to another version of our tour through the Medicare Center. I see that you can probably see, like I do, that they got my name on top and Jason below, but I promise you, I've got about 2 minutes worth in this, and Jason's going to be taking the rest of the time.
I've got another 2.
But we're going to have some fun here. And what we're going to be doing today is basically learn how to import client drug lists from Medicare.gov to MedicareCenter. As we've been talking about over the last few months when we've been putting on these webinars, is that MedicareCenter is a powerful new platform that enables MA, PDP, and Med-Sup producers to produce more, especially during that time crunch that we call AEP. The historical evidence with this MedicareCenter product, it ramps up production exponentially. Whether you're a 2-person shop or a 20-person shop, there is a lot to be gleaned from this tool that we've got. It includes scope of appointments. Last week, I think we worked on the textability. That to me was about the most promising of all the pieces that are in MedicareCenter, was the ability to text a scope of appointment. It was easy, it was quick, it was very simple. We showed it step by step about what happened on the receiver's end, what happened on the broker's end. Just really, it just going to make a big difference. We can do plan comparisons, utilize the quoting tools, the enrollment tools, a universal login. I hate logins. I don't know about anybody else, but I hate logins. Every time you got to try to figure out and remember what's your username and ID, one spot brings everything up that you've got under an integrity partner, as well as a universal login and a CRM, that client retention manager. Unbelievable. It's going to be getting better. Not the best thing on the marketplace, but it's a very competent tool. Today, again, we're going to master how to import a client's prescription list from Medicare.gov. Jason, take it away.
All right. Well, first of all, we should probably start out with some caveats and talk about who this is for and who it's not a good fit for. And first of all, if you're an agent who really struggles with the technology, just aren't comfortable, this probably isn't going to be a great fit. That's not to say you can't learn, and we hope you can. But your client, they do need a few things. They need a MyMedicare.gov account. If they don't have one, the system will prompt them to create one. And once they create that and log in, there will be all their prescriptions waiting for them in there. If they've ever had them filled through Medicare, they'll be there. They do need an email account and a basic level of comfort using the internet. Again, you can kind of get a feeling for your clients. Are they capable of this or are they not? Some people you can just tell right off the bat, this isn't going to work. But others, people who have recently retired, they use technology at the office, this will be fine.
That curve, you're right. You're absolutely correct. When we start talking about some of the people that we've interacted with, these 65-year-olds now are competent and they're looking for this.
Yeah.
They're looking for this technology.
Yeah, so just keep that in mind. As with anything, Steve just mentioned accounts. Every site you use on the internet, you have to have an account. And for some people, that's just a real hurdle. And I get it. But again, MyMedicare.gov, that's going to be a piece of this puzzle. So moving on, here's what we're going to go over. We're going to talk about logging into MedicareCenter, how to get to the Medicare app, which is just one of the many tools in MedicareCenter, and how to search for your client. Are they already in the system or not? And if not, we'll add them. Next up, we're going to go to the prescription page for that client, and then we're going to ask them for access, and that's just done through a series of just a few emails. And then finally, once it all works, we'll view their prescriptions. So we're going to start out and take you through this using just screenshots, and then that's just going to give you kind of a high-level overview of what steps are involved. And then once that's done, we're going to launch into a live demo, but we're only going to take you so far because we don't want to put in people's personal info on a webinar. And so basically we'll put in Steve's info up to a point. We'll invite him to join, to connect his account, and then we'll stop there. So anyway,
Okay. We're good.
Step one, get started with Medicare Center. So if you have an account already, that just means you're going to log in. And if you don't, you're going to come down here where it says set up a new account and register. Okay, so as the agent, that's what you're going to be doing. And as we go through this header bar at the top, if you see that in dark blue, that's what you as the agent are going to see. And if you see it in a kind of a brighter blue, that's what the client will see. Okay, so you log in. From there, you're going to see the available tools. So MAPDP, MedSup, and the CRM tool. So you're going to click on the Medicare Advantage PDP button, and that's going to pop up and give you two options. And those are Medicare App and Medicare Link. And each one of these has a lot of pros and cons behind it. One of the pros of Medicare App right now is it has this functionality that can connect to my Medicare.gov. As far as I know, Medicare Link doesn't do that yet.
Okay.
So,
And as a broker, we can utilize both products. We can actually
Yep.
have accounts in both Medicare App and Medicare Link, right?
Mhm.
So basically, if I'm one of you guys sitting out there and I've got clients coming in, I'd be familiar with both because both Medicare Link and Medicare App have some glorious high points.
Yep.
And again, like Jason says, there are some things that doesn't fit very well. That blue button on that Medicare App that gets the prescriptions is
Yeah.
very valuable.
And Integrity kind of builds Medicare App versus Medicare Link, Pepsi and Coke. Some people like one, some people like the other, some people like both. But we're going to stick with Medicare App for this walkthrough. Okay, so once you click on that Medicare App button, it takes you here, and it's asking you to search through your existing clients. So what you would do in this case is you type just something into one of these fields. So whether it's a first name or a last name, you could type Spinner into the last name field and hit search. And I advise that do the search first unless you're absolutely positive that they're not in the system yet, because if you don't and just go right to adding them, you have the chance of duplicating it. So you might have the same client in there twice. So if you don't see them in the search results, then you can click on that new profile button at the top. Okay, so from there, you have to add at a minimum these three fields: zip code, first and last name. You can add as much as you want, and if you have time, the more you add, the better. Joseph just asked if the screens look similar for Medicare App or Medicare Link. They are different systems, and again, Medicare Link does not have this functionality right now. So
if I'm a broker and you're wanting to import those Medicare prescriptions, we have to use Medicare App at this point.
correct. Yep. Okay, so you'll want to add your client's info. So fill out as many of these fields as you can, but at a minimum, if you're in a rush, just these three will get you started. Okay, and then next, you have the option to step through these 4 tabs on the left in order, but you can just skip right ahead to the prescriptions screen. And this is where you're going to have the option to either type in prescriptions manually, or if we look at the gray box below, you can connect to MyMedicare.gov. So you might want to fill out your client and ask them, have you used MyMedicare.gov before? If they have, and you get the sense that they know how to access it, this is going to be a good fit. So in that case, and again, focusing on that gray box, in that case, if you've entered their email address before, it will be there. If not, you can add it now. So you would add their email address and then simply press on send email. And then from here, they are going to get an email that looks like this. And it's going to say connect to MyMedicare.gov to allow Connecture Inc. access to easily download prescriptions. And the Connecture thing might raise an eyebrow. That is the technology vendor that created this system. So behind the scenes, Connecture is the company that has created the software. And on a side note, they also created a lot of the software that runs the Medicare website itself through CMS. So So all your client has to do, they get this email, they press the blue button, log into MyMedicare.gov. And when they do that, it's going to take them to a login screen if they have an account, and otherwise they will have to create an account. After that, they'll see this option. And so Connecture is asking to connect to their data. So they'll want to click on Share All of My Data and press the button that says Allow. Okay, and Marin asks, who's the sender for the email that asks them to permit Connecture? That email comes from you, the agent. It will, I believe. I'll make a note to follow up on that. I went through this a while back, and if I remember correctly, the sender email is from you, but I'll verify that, Marin. Okay, so next, after they click that Allow button, they're taken to this screen, and it's just a confirmation that says you've shared your prescription successfully, and it's going to list what prescriptions are in that system. And then you, as the agent, will get an email saying your client has successfully shared their prescriptions, and then you've got a link to a button to log in again. So once they've done that, you can log into Medicare Center and again see that list of all their medications, and and
is it advisable for them to have their client on the phone to go through this list? Or we've talked in the past about things about like prescriptions that are no longer valid.
Right.
Can they edit this at this point?
I believe so. So back in this prescription field, you can type those in manually.
Right.
Once you import them, it's going to list them, and they're going to look the same. The destination is this, or the end result is the same. It's just how you get there.
Okay.
So you're going to see a list of prescriptions. And
my thought is that if there's 10 prescriptions there, and the guy says, well, listen, I only take 4 of these. I don't even do that anymore.
Yeah.
So can I not count that to get a more accurate?
I believe you can remove them. Yeah.
Right.
And again, back to the clients who you get the sense are really comfortable with this. If they're on their mobile phone all the time, they might be able to do this while they're sitting across the desk from you. Or you can call them and talk them through it. This kind of comes back to, as the agent, you need to be somewhat familiar with how this works.
Yeah, it's clearly something that you want to take a step up from a beginner.
Yeah.
You don't want to be a novice and work with this, because there
Right.
seems to be some batting back and forth.
Yep.
Of some data, some requests, and some emails. So,
yeah.
But again, the 65-year-old, they're looking for this. They're looking for the technology.
Absolutely. And I'd say as an agent, if you or your spouse are at this age, run through it yourself. Use yourself. You don't have to write yourself a policy necessarily, but you can at least get into the system. Add your husband or wife and invite them and walk through it together and just see in detail how it works.
A dry run, sure, makes sense.
We've got a question, and this will apply to their account whether you're signing them up for MAPD or PDP. Yeah, I mean, we're just running the prescriptions. So at this point, we're not enrolling them, we're just running quotes.
And I think his question is, can we apply what we see to either a PDP plan?
Oh, yeah.
Or to an MAPD plan?
Yep.
So this would be applicable either direction?
Correct.
Okay,
so let's just jump into a demo. Let me stop here and share a different screen. Okay. So once you get to Medicare Center, you're going to see the login button. If you don't have an account yet, just click on register down below. So let's press login. And I'm borrowing a coworker's account. So we log in, and there's our 3 options: MAPDP, MedSup, and Client Management. So we're going to click on MAPDP, and there's our options. Medicare app is the one we want. Click on that. And it's going to load. And like I mentioned before, the first thing we want to do is search. And we can do that right here from the first screen. So I'm just going to put in Spinner as the last name, and I'm going to search my client database, and we didn't find anybody. So we're going to create a new profile. And zip code,
6521.
Steve Spinner.
Yeah.
All right, and I'm going to go ahead and add his email address right here. And you can add phone number, address, add as much as you feel like you have time for in the moment, but sometimes it's easier just to get out of the way now versus trying to come back and clean up. We've got spots for Medicare ID, their effective dates, all that. If you want to add a note, you can. If you want to add a follow-up task for later, call Steve in a month, whatever it might be, you can do that all from here. Okay, so I added bare minimum right now, and we're going to come down here to the bottom and click Save. Okay, so now we're saved, and next thing we want to do at the bottom is go to Add Preferences. You can get there other ways. You could go to Continue to Plans, but I'm going to choose Add Preferences. I think that's the most direct route to get to the prescription info. And again, if you remember from before, I said you can step through these pages, getting started, health, or just jump right to prescriptions. So let's just click on prescriptions on the left. And since we added Steve's email address before, it's pre-populated. So this is the spot where we really can't go any further in a live demo, but I know that was quick, but we would hit send email, and Steve's going to get that email asking him to log into MyMedicare.gov and approve connecting to his account. So if you like, I can go through that again. If anybody has any questions, please jump in.
Pop the questions in there. You've also done a demo that's on our blog site, right? Or
yeah,
why don't you talk a little bit about that?
Yeah, basically everything we're going through here, we have a blog post, and actually as soon as this webinar is over, we're going to take you there automatically. So there's a video walking you through this. There are step-by-step instructions. So yeah, it's all there for you to walk through and refer to later. But again, if you guys have a spouse or a friend you can test this out with, I highly recommend doing that before you get into a real client situation. So I know that was quick. We do have a question. Do you have any other tips like this that make the whole enrollment process easier? I'll have to throw that over to Steve. I'm not a licensed agent myself. I'm on the marketing team here, so I don't do this every day.
Yeah, you know what? We probably need to focus that on just a webinar all by itself, and we'd probably ask for some input from you guys.
Right.
How does it make your job easier? Because again, when we see this intimately over the last 4 or 5 months, maybe 6 months, we are working with a very limited amount of knowledge, but we're trying to get out there.
Yeah.
The more information we get, the better, the more rich that information can be going out about how it makes your job easier. I can tell you this, here's the number one thing. This office included, that the more offices that have been successful utilizing the Medicare Center have an agent that's in there making this pitch over the telephone or in person. And then they've got a handoff person that takes care of the application from that licensed agent, an assistant that takes that application going from that point forward. And this is what it does. Here's what it does. It frees the agent up that you can block an 8 o'clock phone call, 8:30, 9, 9:30, clean throughout the day, because it's not going to take 30 minutes, or you can limit yourself to 30 minutes on any over the telephone or any in-person, where you can simply hand off the results of your appointment and kind of get away from that chit chat that can happen during AEP. This is how we can turn a day where you get like 8 appointments done into 10 or 11 or 12, which is all just money in your pocket without utilizing more talent or more sophisticated tools here. It is a tool from the standpoint that it allows you to employ a system that allows the broker to have a certain responsibility and then to have a sales agent there ready to take care of the application itself. So that would be the first one that I would come up with. This is from an anonymous attendee. So we welcome any other suggestions because we pass them right along. But that's been the number one thing when we talk about Medicare Center out there.
Yeah, and this Medicare Center has a lot of little nooks and crannies. So we are going to be doing more of these with other items, but we just don't have that mapped out yet. You know, as with any software system, there are probably features you use every day, and then there's ones that you didn't even know existed. So we're going to kind of dig in over the next few weeks and try and find some of those for you to help. Russ says, I see MyMedicare.gov and MedicareCENTER.com. What's the difference? So Medicare.gov is the CMS government website. So when someone has a prescription filled, you know, all that information gets passed through the pharmacies to CMS and it gets stored. So Medicare Center is a software tool that's allowing us to run quotes, but it's connecting to MyMedicare.gov to pull in some of that prescription data. So I hope that answers your question.
Okay.
So do all the carriers show up when you're doing an MAPDP quote, or only the ones you're appointed with as long as it's an integrity partner? What if I'm appointed with an MA carrier and it's not with an integrity partner? Do I need a release to make sure that I see that in Medicare Center?
The answer is yes, I'm afraid. It doesn't matter what integrity partner that you've got that contract with, all of them show up as long as it's an integrity partner. But if it's a non-integrity partner, those are not going to show up. So the answer would be yes. Integrity designed this basically greedily, maybe, is to make it as easy as it can be for you to have all your contracts in one spot. And in order to do that, it has to be held underneath an integrity FMO.
Yeah. So when you logged in, it showed the MedSup button in the middle. What's that? Can you do MedSup apps in the Medicare Center? You can.
Yep.
And so if you're familiar with CSG's quote engine, that's what that is. So we have a little extra time, so I'll just jump in there and show that to you. So sorry, I've got a bunch of windows in the way.
Yes, Phil.
Yes, Phil. That's yeah. There you are. So back here on the main screen, you see the Medicare Supplement button. If we click that, it's going to take us to CSG Actuarial. And this is the quoter you use with us, with every FMO. And so there are some differences. This is limited to MedSup. I know some of you use CSG through your FMO, whether it's us or someone else, and you might see different options. So you might see dental, PDP, HIP, you know, things like that. So, but this does take you to CSG. And let's see, how do we know which FMOs are integrity partners? Is there a list? Probably on Integrity's website, there should be a list.
There's a rather extensive list on integritymarketing.com, and they've got a list of all the different partners. Phil asked an earlier question regarding SMS. I need to back up. There's two SMSs out there. The SMS in Columbia, Missouri is a partner. The SMS in Omaha, Phil, is not. So just we'll clarify that. So.
Okay, any other questions? All right, well, hey guys, like I said, this is going to take you to a page walking you through every step of this right after this is done. And if you have any questions, feel free to ask.
Email us and let us reach out, because we sure enjoy it. You guys are absolutely the best.
All right, thanks very much.
Until next time.